Welcome to Fruit of the Spirit Ministry. This is Cherubim Speaks here. God bless you. Thank you for tuning in today. I have a special guest today, Rey Dela Cruz. What does he do? He is looking after that silver-haired group, the 65 and over group from Medicare, Medi-Cal, Part A, Part B, Part C, and Part D. How are you doing?
Fine, thank you.
So, Rey, how has your day been?
It's been very busy, like always, but it's been very productive. Thank you.
Now, tell me more about the 65 and over crowd and their medical care benefits and what should they be doing?
I believe that they should educate themselves in what the 65 years of age when they turn into Medicare. A lot of them are misled and they don't know what the benefits are. And so they should read their Medicare handbook when they receive those every year in October. And if they have any questions that they don't know about, they can call us. We give them free information.
What is the difference between Medicare and Medicaid? What is the difference?
Medicare is the insurance for the seniors in replacing their group insurance when they enroll. Initial enrollment is usually 3 months before their birth date and 3 months after, so they have a 7-month that they can enroll into. That will replace their immediate hospitalization insurance from the group that they had when they were working into the Medicare group, which they were 10 years or 40 quarters. They're entitled to that. They have to get the Part A and Part B.
What's the difference between Part A, Part B, Part C, and D? What is the difference in those categories?
I'm glad that you asked that because in the Medicare handbook, they especially put the A as the hospital coverage. The B is the outpatient coverage, meaning outside the hospital, you see your doctor, your primary care specialist,
right,
and the blood tests, x-rays. Those are the Part B that needs to be covered, the Medigap, they call that, the 20% that's not covered.
Oh, okay. Most seniors, if they need skilled nursing, how does that part work?
The level of care for seniors, when they come out of the hospital, they get discharged to the rehab called the skilled nursing facility, or they known as SNF. That is a 24-hour care where they will rehab them. They will review how they're doing within the 21 days. And who are they is the utilization review committee that consists of the therapist, the business manager, the doctor, to see how they're doing. If they're plateauing, then they will cut them off. That becomes now a private pay. But if they're improving, they can have up to 100 days where Medicare covers up to 100 days.
Oh.
That's the short-term care. Then it becomes long-term care. They do not cover that.
So how do they plan for long-term care?
Not many people plan, and some do. They bought long-term care insurance. And the problem with the long-term care insurance, it's not working. The premiums are skyrocketing. So a lot of the companies pulled out, including John Hancock was one of them that also increased their premiums, CalPERS. And the increases are very high. This year, CalPERS increased their premiums up to 85%. 2006, 2007, 33%. And before that, it was 25%. So if you're paying a premium of, say, at your age at 70, and now you're paying at almost $7,000 a year, if they're going to increase that to 85%, my goodness, that coverage is no longer good because not many people can afford that at retirement.
So they're thinking the older you get, the more likely that you will be sick. So they up the price just because of your vulnerability to get ill.
Well, long-term care is very expensive. The insurance is very expensive. what happened is they miscalculated the claims. When the claims started coming in, of course, you pay a $10,000 claim per benefit or per senior. That's going to wipe out what they have in the reserve. So, long-term care, there's other alternatives besides buying long-term care. They tell you that in the Medicare handbook, which I brought here today.
Right,
okay?
right.
And in this handbook, they mention how you can get your entitlement by repositioning your asset using a irrevocable trust, annuities, things like that.
So you're saying a living trust, that covers your assets up, so you wouldn't, your medical care costs would stay low? Is that what that is?
No, the living trust, it states here in this book called Taking Care Tomorrow by California Department of Aging. And basically, again, I use these books so that way they'll know. Say, for example, if I may read this, will a living trust protect my assets from long-term care costs? And in the page here it says, an irrevocable trust is often promoted as a means of protecting a person's assets, getting around the rules of Medi-Cal eligibility. Now, we have an attorney that does the legal part, but the problem is there's not many people holding the family's hands in how to succeed to get that eligibility. We do that. We educate them. We work with the families. We work with their friends, their church groups, you name it. We will give them the information. So clearly they'll understand. That way they can make a decision, the right decision.
So the power of attorney puts that, it doesn't hide their assets, but it puts it in a better position?
No, the durable power of attorney is giving somebody to manage your assets for health management and also your asset management. Because if you're laid out in the hospital and going into the nursing home,
right.
The question is, how are you going to pay it? Now, because it becomes long-term care. The short term is covered by Medicare, but long-term care is not. Now, Medicaid or Medi-Cal will do that, but you have to qualify. And a lot of people don't know how to use these program or navigate it. And so what we do is we work with who has the power of attorney. While they're alive, they can use that. Once they pass on, then the living trust will take over, which we have an attorney that explains that to the client. We have a group of professionals that will give the answers to them. So, working on this for 27 years now, I'm networked with a lot of professionals that will help them with that.
So you know the people that could enroll, put them in, and put them at a comfortable level.
Placement.
At their age group, because they are vulnerable because they're on stable income.
Correct. If you look at the cost of long-term care in the data the government gives us, it's costing about $100,000 a year now, and that's going to escalate in 2020 to $150,000 a year. So a lot of the seniors will get wiped out, or their families. I call that old money, and if they don't protect and preserve that, their children or grandchildren will not receive that, so you're impoverishing the family. And what happens? The children doesn't have college money. The children that needs the money to give them a easier life, well, now the old money is gone, so the family tree is going to struggle. So by using these entitlements, we can show them how to protect and preserve the money to transfer for the children's education, so they don't have to go on Medi-Cal. So they have jobs. They have a trade because they went to school. Without that money, it's difficult for you may say 18, 19, 20 years old to get an education, because where's the money coming from?
So it attacks the parents' nest egg.
Correct. The nest egg, once we do the planning with them and they understand it, the nest egg is protected. They'll just basically pay the income for their long-term care, health care.
Oh, so that, and that'll escalate.
That's right. And so if there's a spouse at home, the spouse can receive the minimal spousal allowance, they call that. so that way she can stay at home and not be impoverished. But again, if somebody's in a nursing home, then, and if they don't have this in place, the nest egg for the spouse,
Right.
she's going to struggle when he leaves because his income is also going to go. So now you have one income in the household, and the nest egg that was there for the rainy days is no longer there. So
Because that's been sucked up by medical bills and medical care. And,
the long-term care.
oh, wow.
So it's a good announcement that we're doing here today because, again, these are not my books. This is the federal government called the Medicare and You. Every year they send this out, Centers for Medicare and Medicaid Services, Medi-Cal in California. And the question is always, how do we get this entitlement? What about a look back? California's 30 months look back. The other states is 60 months, that's 5 years. Illinois is 36 months. But
36 months to get enrolled?
no, that's the look back is a disqualification. That if you transferred and you did not know the right way to transfer or reposition the assets,
Right.
you would have to wait 30 months in California. In California, we have methods that we can go around that, but a lot of people don't know. So these are the things that, questions and facts that they should know.
What about the ADL's activity of daily living?
Okay.
How does that work?
The activity of daily living is in this book. That's basically your ambulating. And how I tell everybody to remember this if they don't have these books is ambulating is getting around so you can ambulate around the house if you're at home.
It's like ambulatory.
That's right, uh-huh.
Okay, that's movement and how they move.
Correct.
Okay.
Okay. Now, the B, see AB again,
Right,
bathing.
right.
If you cannot bathe yourself because you're in a wheelchair or what have you, that's another activity of daily living that we need help on when you're doing this, okay? Continence, that's controlling your excretory functions.
Right, right.
Okay, that's another ADL, activity of daily living, that we use.
Oh, okay.
The ambulatory is about 29% of our.
So being able to move around
yeah.
Not in a wheelchair, but
Yeah.
that movement.
Getting around the house, okay, if you're staying at home. So you got ambulatory, bathing, continence, dressing is another one. It's
Right.
hard to dress yourself when you're not well and going around for long-term care. So you got A, B, C, D so far. Now, the eating is the E, okay?
Right, right.
Eating should be defined as getting food with a spoon in your mouth. But a lot of the policies that I see sometimes is tube feeding.
Oh, okay.
So it's very difficult to trigger that policy. Okay, so you got eating now. Okay, so we would like to have the benefits triggered when you need these things, not to where you're crippled, okay, or severely not be able to do the ADLs. So now you got A, B, C, D, E. Okay, now T is transferring to a chair to a bed. They teach you how to
That's
transfer.
right. That's right.
The last one is toileting, going into the toilet in the bathroom if you cannot do that. So the ambulatory, a lot of the policies took out that as to trigger the benefit, meaning they only have now 2 out of the 6 ADL. So if you cannot do 2 out of the 6, then they'll trigger your policy. It used to be 2 out of the 7.
So the ADL, which is the activity that is tied to your coverage?
Correct, when you buy this long-term care. Uh-huh.
Oh,
Yeah.
so and you have to fit these categories to the T, or you won't be eligible for it?
Yeah, because most of the policies is that when they buy these long-term care policies, it's their gatekeeper or the doctors that will make that decision. It should be your doctor. If your doctor says you need this kind of care because you're not safe when you don't have this kind of supervision, then basically you're not gonna get the policy to pay. So that's a lot of problems for a lot of seniors when they bought those. Some of them are called living benefits as well. And a lot of people, when they get sent home and they want to trigger that, it's not
there.
triggering. Yeah. So we want to educate them how to decipher what they have. So if that doesn't Because we have now case studies, that when they don't, and they have those kind of policies and they need the help, we can show them how to get their entitlement instead of using that, because we can navigate that for them.
You know, one of the ones we haven't discussed so far is cooking. And how do this kind of care help, you know, getting somebody, feeding them, cooking, a diet, and all this business?
No, that's called the instrumental of activity of daily living. That's another set of groups, like paying your bills, answering the phone, cooking, getting the groceries. Those are laundry. That's another set that's what they call the instrumental of activity of daily living, okay? So, but the basic ones are the ADLs, how to trigger that. And I use the acronym a lot, which a lot of people do. So that's why I say these books you can download. It's in the website.
Okay.
California Department of Aging.
Okay, yes.
It's called Taking Care of Tomorrow.
Okay, California Department of Aging. And that is a book that anybody over 65 should be their guidebook.
Or the family, because the children are the ones that are burdened to take care of their mom. And they are the ones that's going to get calls when something happens to their mom. And they'll be the one to go into the hospital, go into those Medicare meetings. And I don't wish that on anybody. So it's very, very important that they should find out what the other seniors and families are doing to not go through that road, because it's a hardship.
So I would think that the senior that is involved should reach out to their children and at least try to educate them with these things that are in front of them.
Correct, but again, when they're going through this hardship, and a lot of them do, they go to their church groups, whoever they can ask for to get this information. But if they don't know, they're grabbing in the dark. Well, then they're going to get the wrong answers, or maybe get the wrong people to give them the information. So when we do this, we have a trifold that we tell them, hey, these are the books that we go by. Buy the book.
Right.
So if they go by the book, of course, then they get the knowledge. And the integrity is there, and the ethics are there, because the books are from the government, and thank God, you know.
Right.
I say that because we always think the government's not giving us something.
Right.
But the problem there is how to decipher it. So you got the Fed and the state as a joint, and that's exactly what it says. It's a program with the federal and the state program. It's a joint program. But the problem is, how do you succeed to get that? And how do you get who can help you decipher these? And so we have a group of professionals, and now we're networking with church groups, associations, and they're now beginning to see the contents of these books are so important. So it's very, very, very good that we're making an announcement.
So what would be the first step to a successful situation with a senior?
The first step, they should talk to their families and talk about this. Then they should call somebody like us that has information and can decipher their situation.
Right.
And we give those informations for free. You know, we don't charge for those. So what happens when they get educated? Because a lot of people's situations are different. It's not a cookie cutter. And so when they get that, they'll understand it, and they're not going to be afraid. Because when you talk about going into the hospitals and they're faced with that kind of dilemma, I call it dilemma, and then basically they didn't have any plan. So without a plan, it's very difficult, because now you're in what we call crisis-driven or catastrophic situation. Let's don't have that situation. How we know what not to do is, hey, get the information, help your family.
But now that subject, that subject is to broach that subject with the senior or the parent from a child's perspective. Is there some difficulty there for that senior to acquiesce of that kind of care and this and that? Is that?
It's difficult because the seniors, they have what they call financial planners, of course. They have the banks and their money and all this. The entitlements, what I'm finding out the last 27 years I've been doing is, they don't know these entitlements. So, to get the entitlement, you must share those information with the people you trust that can make your asset management decisions for you when you can't anymore, your health management. And so the problem there is that they will not avoid what we call the spend down.
The spend down?
Yeah, see, your family or spouse can avoid the spend down, find out your options. Their option is to have all of their affairs in order, so when that time comes, somebody like us that can navigate this can do that very simply. You know, it's simple but not easy. It's not easy because of what you just said. The family sometimes are not educated in this. You have one mom, one dad. So how do you get educated if they don't have curriculums in schools? You find out by going through this. And if you don't talk about it and don't have a plan, then yeah, you'll fall into that $100,000 cost a year. And a lot of people say, Medicaid or Medi-Cal, is that for poor people?